Hi everyone, Dr. Amy from Pain Free and Fit. Today, a great exercise for those of you with cervical degenerative disc disease in the lower neck. We're going to be talking about how to change your extension or backwards bending movement pattern from an upper cervical dominant pattern to a lower cervical dominant pattern. Hope you enjoy. So what many people with cervical degenerative discs, herniated discs, and bulging discs of the lower neck or cervical spine, C4-5, C5-6, C7-T1, don't realize is that they're stressing their discs all day long and provoking their pain from forward head posture. When the ear comes forward from the shoulder as opposed to remaining on top of it, there's a flexion or bending forward effect on the lower neck. As we bend the spine forward, it compresses the discs, many times aggravating our disc situation. At the same time as the lower neck bends forward, the upper neck under the skull creates extension force, which is the skull rotating backwards on the upper neck. And that creates tension headaches, joint tightness, muscular pain at the top of the neck. Great exercise to learn how to undo this and to reestablish a normal pattern of extension, which is bending backwards from the neck, is to do the following exercise. If you've had forward head posture for any length of time, typically because you've practiced this motor pattern while driving, while reading, while working on the computer, when you go to look upwards, you're going to use more of that upper cervical extension to look upwards rather than the lower neck where extension is needed. If we get more extension in the back of the neck, many times that's going to reroute the disc nucleus, which is the inner aspect of the disc, into a more neutral position, taking pressure off herniations and alleviating pain due to disc degeneration, bulges, and herniation. So this is the way you would practice it. By setting your shoulder blades first in a neutral position, again, you need to know what your RPI is for your unique body. If you're not sure what reverse posture isometric is, check out our website, painfreeandfit.com. We have a free body analysis. Learn what type of shoulder blade alignment problems you have, because you're going to want to use those in this or any exercise. You're going to want to correct any rounding shoulder posture, tip shoulder posture, winging or downward rotated shoulder posture, so there's less stress on the muscles that attach from your shoulder blade into your neck while you do this or any neck healing exercise. We're going to start with head retraction, which is basically pulling the face straight back. As I do that, what you'll notice is it slightly flexes the upper cervical spine. It takes that tendency of forward head posture and takes the whole cranium and rotates it backwards, flattening the curve in your upper neck. As you do this, you're going to maintain the head retraction posture, and at the same time, you're going to bend the head or neck backwards as a unit from the base of the neck. That's cervical extension, emphasizing the lower aspect of the cervical spine, taking stress off of the upper cervical spine. Again, the mistake would be rotating the head more than the lower neck while we look up. But again, as we do this exercise, we're locking the upper neck by pulling the face back. That's widening the space between the top vertebra and your skull, creating what we call cervico-occipital stability. And as we maintain that, we're going to bend from the base of the neck backwards as a unit. You're going to feel the motion occurring from the very bottom of your neck now, as opposed to typically the top of your neck. Practicing this movement pattern for repetitions during the day will help you to retrain a new motion pattern, and you can also plug this into strengthening exercises. The first level of that would be simply building up the repetitions that you lean backwards. After a while, you could attach a band around your head, a resistance band, or you could lay face down on the floor. As you lay face down on the floor, same thing, you're going to create head retraction and then extension from the lower neck, which over time is going to build that extension strength up. That's going to decrease the imparted stresses to your lower cervical spine and help you with your cervical degenerative, herniated, and bulging discs. A word of caution with this, always use a range of motion that feels comfortable. Many people get a little bit overindulgent and they create too much extension, which many times can aggravate lower cervical discs if we have too much of a herniation or bulge or facet arthritis in that area. So we want to make sure that we always use a motion that feels comfortable. It's not provoking any pain while we do that exercise. And remember, hold your shoulder position in terms of your scapular alignment in proper posture. If you like this video on lower cervical extension being dominant over upper cervical extension, subscribe to our channel. We got a lot of great videos out there to help you with chronic neck problems due to cervical degenerative, herniated, and bulging discs. Questions or comments, write in. As always, I'll do my best to answer them. If you give me a thumbs up, help me share this valuable information with others. And remember, if you're looking for a great program that's tailor-fitted for your unique mechanics, your unique spinal stability issues of your chronic neck pain, check out our neck pain healing exercise program available at painfreeandfit.com. It has a full body analysis to let you know where your shoulder blade and head and neck posture and movement issues are, where your stability issues are, where your muscle imbalances are, and then it teaches you how to create a targeted program that addresses these things in a strengthening and self-rehab program to help manage your chronic pain, get you active again, feeling better, and back into an active lifestyle. I hope this video on cervical extension being dominant in the lower cervical spine over the upper helps you with your cervical degenerative, herniated, and bulging discs.